Okay, the other big survey that goes on every couple of years is done by Gallagher at the University of Pittsburgh. This one goes to the counseling center directors. These are the people who run the college mental health services throughout the country. It's a limited survey. It's predominantly 284 institutions, mostly up and down the East Coast, some in the Midwest, and a little bit in Canada. But it's a very important one because it samples the people who are running these services, and this represents, as you can see, nearly 3.5 million students. The 30% we're seen in other contexts refers to the fact that outreach programs are becoming increasingly needed. People in college mental health services have to begin to go outside of their centers and reach into the dormitories, into the classrooms with professors, and a whole host of other kinds of organizations. 9% sought counseling in the past year. The one, for me as a psychiatrist, the problem with what's going on in this country is that 40% have no psychiatric time whatsoever in this country. And those that do have the availability of a psychiatrist often have them for only a couple hours a week. Now, I have made the point that the patient acuity is rising dramatically, and there are some difficult students that we're seeing with psychotic disorders and very other kinds of difficult issues to treat. But if you look at this Gallagher study each year, high on the list is the wish for the counseling center directors to have more psychiatrists. And I won't bore you with all of the things, everybody kind of talking about the same thing. Quarter of them, of the center patients, are on medication. It continues to rise. The first survey in 1994 had almost below 10%, and now in 2003, 20%, and now we have more than 25% of the students being seen in the counseling centers throughout the country, for example, that are on medication. Nearly 100% of the counseling center directors have said what I've said to you 6 times already today. Many of the students we are seeing are not the result of the roommate from hell. I lost my girlfriend back in Iowa. I didn't get into the fraternity I want. That's not the stuff that we're seeing, at least in Wright State. We're talking about serious kinds of issues, big-time depression with a great deal of morbidity, and we're concerned about that. So this acuity of problems is very different. You know, when I was a child psychiatrist in training, I was told that the period of adolescence was supposed to be one of normal psychosis. That is not true. That is not true. When I see a kid at 13, 14, 15, or 18 who's in trouble, he ain't going to grow out of it. All of our clinical studies say that if you've got somebody who's struggling at that point, you need to make an intervention. You don't grow out of this stuff. What happens is that life goes on, it gets more and more complicated. So it's very, very important. The staffs are having their own difficulties with burnout and things like that, and waiting time, and and the problem is that more and more of the students, as you look at the last 10 years, are having to be treated elsewhere because their conditions are so challenging that oftentimes counseling graduate students or social worker, nurse practitioners, or things like that, people like that, are not able to provide the kind of intensive care that's needed. You probably need to adopt a community mental health model for college campuses now. These can no longer be silos. We have to look across bunch of different sectors to provide the kind of care that we need for our college students. 2/3, growing demand, no increase in resources. We hear that over and over again. More than half reported increase in self-injury of their students. Eating disorders are up, 2,000 hospitalized, 118 suicides that one year. And the post-VA tech impact, of which I will have some things to say later, is really manifested by the increased level of anxiety, concern, and wish for services from faculty who are now alerted to what we hope are significant danger signs. And so we are talking about more and more administrative kinds of things also that counselors are having to do as they interface with administration. And parents, too, are becoming more and more anxious, and they very much want to be a part of the picture. I will tell you that when I testified at the VA Tech panel that was run, I think the most heartbreaking thing that I heard from the parents came up is, why in the hell didn't you tell me my kid was in so much difficulty. And I'll tell you why those people didn't in a minute, and you'll see what the legal and ethical issues are. But I think most of us are moving more and more to integrating the parents as important resources in the care of these students, but with limitations which I will shortly tell you about.